Hello, good evening everybody. This is Dr. Kiru here, live with RevitaLive with Dr. Kiru. As you can see, I've got my face mask on in mark of the current pandemic that we are facing, which is the COVID-19 situation. And as par with government ruling, we are entering a phase where tomorrow we'll be commencing our government restriction movement order, and it's going to be a challenging time for us Malaysians. To take the momentum away from this situation, every Tuesday evenings I actually will come on live to discuss another epidemic that is actually affecting us as well, and that is none other than the epidemic of obesity. So, okay, I think today I will take off my mask now. So, I'm very fortunate today to have a guest with me who's an expert in reproductive medicine. He is none other than Dr. Somaskandar, consultant obstetrician and gynecologist with special interest in reproductive medicine from Gleneagles, Penang. So he will be my guest today to speak on the field of fertility and obesity. So with that, Dr. Somas. Oh, hi.
Hello.
Hi, welcome.
Yes, welcome. Sorry, I had to remove my mask.
Okay, yes, please.
How are you, Dr. Kiru?
I'm fine, thank you.
Thank you very much for inviting me over to this live on Facebook. I've never done this before.
Yes.
And it is very exciting. Oh, my hair looks short. It is very exciting to be live on Facebook.
Yes.
To talk about obesity.
Yeah. It's a pleasure to have you as well. Maybe you'd like to come a bit closer. Yeah.
This is not according to the social distancing that our Prime Minister was talking about.
Correct.
But never mind, it only starts tonight at 12, so we can still sit side by side.
Yeah. So I think we have to practice the maneuvers that we've been advised. That is, of course, no handshaking and keeping 1 meter distance from each other, and of course having a face mask while we're in the hospital as well. And I think these are the important measures that we need to take, as a precaution this time.
And if you are going to sneeze, make sure you cover yourself. And if you're coughing, stay away. And if you have fever, please stay at home and get yourself tested.
Okay.
Or you can self-quarantine yourself at home.
Yes, correct. So, Dr. Somas, actually, since I have a very special interest in the overweight and obesity treatment, so I think currently you're aware as well that the prevalence of obesity and overweight is increasing in epidemic proportions as well. And we find that overweight and obese women, they tend to have a higher incidence of like menstrual dysfunctions, and some of my patients have anovulatory complications as well, and leading to some form of subfertility or infertility.
Subfertility issues. Basically, because they say that this obesity nowadays we're looking at, it's not an adult scenario anymore. It's also a childhood scenario. Sometimes the grandmothers will say, "Oh, the baby is so cute, feed it some more milk," and then the child is so obese. And that leads to delayed menses, delayed puberty, and then they also somehow come up with menstrual issues. And there is a known entity called the polycystic ovarian syndrome, where these women have got menstrual problems as well as they're obese, and also leads to some amount of subfertility. So yes, it is a very important issue that I think we should address it early, so that people are aware and they need to know where to go for help when this situation arises.
Okay. So Dr. we start with something very basic. How do you define infertility actually?
Basically, infertility by definition, WHO definition, basically it means that you have had unprotected intercourse for 12 months. That means basically 1 year. And so if you are unable to, because they say about 70 to 80% of the population the women will conceive within a year. And so if you have not conceived after a year of unprotected intercourse with your partner, then yes, you come under this category called infertility. Infertility can be divided into primary infertility, that means you've never conceived before, or secondary infertility, which is also very common, where you have got a child, you're trying for the second one, and there is an issue. 2 years, 3 years, you're still unable to conceive. That is secondary infertility. But usually it's about 1 to 2 years.
1 to 2 years, I see. So, based on the definition, if we take it as within after 1 year of unprotected intercourse and so on, it should theoretically affect both men as well as women as well, right?
Yes. Always, whenever these patients come to my clinic, I always say that we should see the couple together, not only the women, because nowadays we also know that men have also some amount of, they also contribute to the subfertility issues, and obesity in men have also shown that there is some amount of subfertility issues with the sperm activities and sperm morphologies. So yes, both male and the female should be screened and treated.
So if let's say currently you have a couple who comes into your clinic, and you have actually asked them to screen them in terms of their BMI, to look at them whether they are obese and they fall into that category. So how would you approach them?
I would start with since I'm a gynecologist,
Yes.
I'll start with the female first.
Yeah.
I'll find out about her menstrual history, how regular are her periods, because as you know, BMI more than 24, 25 fall into the category of obesity. So, and studies have shown that when your BMI is high, your periods are not regular. So if your periods are not coming on a regular basis, which is basically every month, it doesn't have to fall on exact date, but 28 to 30 days, sometimes a bit earlier. If your periods are not coming every month, then most probably your ovaries are not producing any eggs. So if your ovaries are not producing eggs, then we need to investigate why it's not producing, and most often it is because of obesity that causes ovaries to produce polycystic ovaries, which also sometimes can lead to producing some amount of male hormones,
Yes.
serum androgens, and
Correct.
then they have other issues.
I think sometimes it comes as a complicated package as well.
Yeah. They call it a metabolic syndrome, where they also come with what's it called, heavy periods or no periods at all. Sometimes they have lots of hair, sometimes they have beards, sometimes their tummy becomes very fat and all that. That also, all this leads to some amount of menstrual issues as well.
I see. And then, is there any blood investigations that you normally will do for your patients?
Yes, routinely first after the examination, after confirm there is some issue, we'll do some blood investigations. Basically, besides the gynae hormonal investigations, we also look at the cholesterols, we look at the sugars, the HbA1cs and all that, ultrasound of the pelvis to look at whether are there any polycystic ovaries, and also we look at the male hormones, the levels of the serum testosterone. But you mustn't forget, we must also always examine the men, because sometimes both partners can be obese. As you know, the Prime Minister has told us to stay at home, so we'll be staying at home tomorrow, and we have nothing to do. We'll be eating, and so we need to look at obesity as well, the male partner as well. And because in men we look at the seminal fluid test where we look at the number of sperms, the quality, quantity, and all that. So sometimes obese men also have some issues with the sperms.
So it looks like Dr. Somas, probably 9 months from now, probably you'll be looking at a spike of birth rate probably.
We're looking, I mean, we are hoping, but then you never know, because since there is it's not called a lockdown. What is it called again? It's called
government restriction movement.
Restricted movement. So please do not go to the movie theaters. Please stay at home and watch a Netflix.
Yeah.
And if there's nothing else to do, then you can always give us a call, and we will help you how to lose some weight and go on a good diet.
Yeah. In fact, I saw some of my colleagues actually shared on Facebook itself. The counters for the condoms were all sold out actually.
Yes. And being an obstetrician, I wish I had bought all the condoms.
Okay. Okay. Dr. Somas, I think we have a segment actually in between, which is called From the Kitchen. Yeah, our meal has just arrived.
Looks very interesting.
I'm sure you haven't had your tea yet.
No, I haven't.
Yeah.
Thank you very much. I didn't know it comes with.
Yeah. So part of the package of being on the show is that we actually have a meal provided to us thanks to our wonderful kitchen.
Kitchen in Gleneagles?
Gleneagles, Penang.
Gleneagles, Penang. Wow, very impressive.
So we have with us today actually two preparations. I'm not sure they can see. Yeah, the one on my right here is actually a banana pancake. It's
Yes.
quite delicious.
Yeah, yes.
And the one on the left is ciabatta egg sandwich.
Oh, wow.
Okay, so I'll start with the pancake first. So banana pancake, as we know, is made from bananas, very healthy, good dietary source of fiber, potassium, and antioxidants. So when we have patients who are quite low in potassium and probably having diarrhea and so on, it's a good source to replenish your potassium level. And this mineral is essentially very important for a healthy heart and for, of course, blood pressure control. And ripe bananas are always a great way to add sweetness to your pancakes and your desserts, and it's a good choice to satisfy those who like something sweet and with relatively fewer calories. So, Dr. Somas, take a guess and see, 2 banana pancakes, how many calories do you think they are?
The pancakes look quite small, so I presume, knowing it's coming from Gleneagles, probably not much calories, maybe 10 to 15?
Actually, there was 250.
Wow! Very impressive.
So even this small little fellow here is 250 calories.
Yes,
So just imagine one whole nasi kandar and so on.
Yeah. I mean, nothing beats nasi kandar if you're in Penang, but never mind.
Okay, so next I'll go to the ciabatta egg sandwich. As you can see, the ingredients highlighted is of course eggs.
Yes.
It's because the main thing is eggs. And of course, eggs are a good source of inexpensive and high quality protein. Okay, so those who are into bodybuilding, building your muscles after a period of weight loss and so on, of course, you have to take some eggs, rich about 6 grams of protein in each egg. And it's a rich source of a variety of nutrients as well, vitamin B6, B12, vitamin D, and then some minerals as well, such as zinc and copper and iron, of course.
Zinc is very important for male fertility. Because zinc and all have shown that it increases the sperm count and sperm motility. So probably we should advise the men to have eggs every day.
Eggs, okay, that's very, very interesting, because on my part, as in bariatric surgery, for those who have undergone bariatric surgery, zinc is very important as well, because a component of protein loss with zinc deficiency will result in a lot of loss of hair. So we got to supplement our patients with zinc and proteins as well.
Not my hair.
But yours, of course, is not because of surgery. And of course, proteins in the eggs as well will increase your satiety. So I think an important part of it is feeling full. You know, a lot of us feel hungry most of the time. We don't actually feel full because this is due to lack of GLP-1 hormone and so on. And eating this will actually result us in feeling full longer. And reduces the urge to snack. I think the problem now a lot of people have is snacking.
Yes, especially this fast food.
Yeah.
And all that. Yeah.
And it's not going to help because now you're going to be restricted at home, and probably that's what they're going to be doing.
So they should be having Gynaecologist banana pancake.
Okay. And sufficient protein intake is of course essential in maintaining muscle mass. I think that's important, and I think it's a good way to keep yourself at home, probably do some exercises and so on. Would you like to take a guess how many kilocalories is inside this egg ciabatta?
Oh, this must be about at least 500.
Okay, the good news is that this is only 125.
Oh, I'm really bad at guessing.
So 125 kilocalories, and your banana pancake and another 250. So total is about 375 for this delicious meal.
And it's only for tea.
And this is for tea.
Yes, you can skip dinner.
Okay.
And coming to skipping dinner, is it true that if you have this intermittent fasting, helps with losing weight and missing a meal? Is that true?
Okay. The concept nowadays of fat diets, where we have the Atkins diet, the South Beach diet, the ketogenic diet. There's so many different types of diets. Basically, how it works is actually it just restricts on certain macronutrients. Either you restrict protein, you restrict fat, or you restrict carbohydrates. So they tend to work to an extent in any diet that you take. But when you combine it with intermittent fasting, it's just about the timing of the meal. So basically, you have different types of regimes. The most common being the 16-8 or the 2-to-1 ratio, whereby you fast for 16 hours and you eat for 8 hours. Okay, so that is the classic intermittent fasting. And you have a spin-off of that where they call OMAD, 1 meal a day, where they have only one meal in a day, where they eat it within a 2-hour gap and fast for the rest of the time. So again, so much this kind of diets that you do, intermittent fasting and so on, it just shifts your caloric intake from a diet that is where you get your energy solely from glucose to ketones, that is from fat. So you got to be careful with that, because some people tend to do more worse with this type of regime, especially those who are diabetics, whose blood sugars are not well controlled and so on, renal failure patients and so on. So if you're eating for 8 hours, the strategy would be probably you start eating at lunchtime, that is about 2 o'clock, and that goes on to small intermittent feeds until maybe about 8 o'clock or 9 o'clock at night, then you stop. And the rest of the period you're actually fasting from tonight, 9-10 o'clock, until the next day, midday, lunch, when you're actually having a meal.
So you're basically missing breakfast.
Yes. There's schools of thought on that. Some say that when you skip breakfast, being the most important meal of the day to some people, you actually use your own endogenous fat stores to fuel your energy. So that's one way of taking it. And the other thing is that you have to take probably fluids like water, be rich in water, and you can take black coffee, because do you know how many calories is there in black coffee?
50?
It's about 5.
So I'm getting closer.
Get closer. So you can have as many cups of black coffee in a day. So it's quite okay. And speaking of black coffee, Somas, here is our drink for today, for tea. Okay, I can't show you actually, but because in here we have barley. It's unsweetened barley. And the good news is that barley contains soluble fiber. Okay, and fiber is very important for us for digestion and for motility, with beta glucan, which slows down the digestion and absorption of nutrients. So that's good. So we can absorb more nutrients as well, and it also curbs appetite and promotes fullness. So it's good. It's another thing that improves satiety. So in this glass of 1 cup of barley, okay, 1 glass. Would you like to take a guess how many kilocalories are there?
35.
Oh, you're very close now. It's 25 kilocalories. Okay, so that's our tea for today.
Yes. What's your opinion on this green tea thing? Because I get patients asking me about going on green tea for weight loss.
Actually, to tell you the truth, I'm not an expert on in that, because but I do know that green tea is an excellent antioxidant. rich in vitamin E and so on. But in terms of whether it helps in dieting or in terms of reducing your appetite and all that, I heard it's really fantastic. A lot of people swear by it, but again, I don't have the science and the facts behind it to actually support.
So, but it's good to go on green tea and black coffee.
Yeah, I think.
So basically, avoid milk.
Avoid milk and sugar.
Avoid milk and sugar.
Yeah. So even our basically our brown tea or what do you call it, English tea that we have in the evenings, I think without sugar, without milk, helps to an extent. But preferably, I prefer to have milk tea as well, but minus the sugar.
Okay.
How about you?
I have milk tea with sugar sometimes.
Okay.
But it's about time because I'm trying to compete with my obstetric patients. My pregnant patients sometimes think the doctor is bigger than them.
Yeah.
So yes, I need to lose some weight as well. I shall take up your offer of black coffee and black tea.
Black tea. Okay.
Yes.
Coming back to our infertility topic, Somas. If let's say a patient, let's say they've been married for about 2-3 years, and they are unsuccessful in their attempt to actually to have a child. So what do you advise this couple? Because I'm sure a lot of them don't know first of all, and then where to approach, and I think they probably will start by going to their GP perhaps.
Yes, correct. Basically, what we should do first is they should come and they can go and see the GP. The GP will be able to do some preliminary investigation, some counseling about weight losing mechanism, exercise, diet, cutting down on all your fast foods and all that. And what I would do also, I will see whether are the periods regular, are there any other issues like diabetics or hypertension, high cholesterol. And usually most of these patients, if they can somehow lose about 10 to 15% of their weight, they will realize that their menstrual cycles are becoming more regular. They don't need any high-end fertility treatment. They don't need any medication. They don't need to spend lots of money on all this IUI, IVF treatment. They just lose 10% to 15%. Their cycles are more regular, and yes, lots of my patients have conceived naturally with some weight loss mechanism.
Okay. So let's address a question first.
Yes, sure.
So we have Min Farahanim. Hi, welcome to the evening program. And Min's question is, how much calories is there for milk tea? So as you know, milk tea or bubble tea is one of the most popular desserts or drinks that we have. It's passionately called as Chenchu Naicha. So in terms of calorie, it depends. Because you have the preparations with bubble tea, you have sweetened with gula melaka, brown sugar, and you have the plain pearl milk tea as well. But I can tell you offhand that every cup, whether you have it in regular size or large, it's definitely almost 250 to 300 kilocalories.
Wow.
And it goes even higher if you're having the bigger cups. So if you're doing, if you're taking that for dessert and everything, then you got to package it together with what you're eating. So probably if you're having a very rich meal, like a steak or a chicken chop or rice and so on, so you're touching almost in one meal maybe about 600-700 calories if you're having a nasi kandar and so on. So I think it's a bit too much, and I think that is one of the driving force that is driving towards obesity as well. So I think we would like to staying on the healthy topic, try to say, of course you have to indulge, you got to enjoy probably a glass once probably a week or so, probably that will be helpful, but definitely not something that you want to take daily.
She's got another question.
Yeah.
Can diabetes cause birth defects?
Yeah, good question.
Yes, very, very good question. Thank you so much for bringing up such a excellent question. Because as you know, diabetics in Malaysia is getting more and more prominent. More and more people are becoming diabetic. Previously, diabetics were only seen in men or women who were more than 40, 50 years old. All the machi-pachis and all that. But now 20-somethings young girls are also being diagnosed to have some amount of diabetics. And you have different types of diabetics. You have the type 1 diabetics where you're born with it, or you have the type 2 diabetics or gestational diabetics. That means you develop diabetics later in life, and you also get it because of pregnancy hormone changes. Coming to your question whether it causes birth defects, yes. I usually sometimes divide my answers into the 3 different segments of your pregnancy: your first trimester, second trimester, and your last 3 months of your pregnancy. So the first 3 months, diabetics can cause high risk of miscarriage. Okay, because the sugars are so badly controlled, the mother doesn't know she's diabetic.
Yes.
So yes, and then they have a miscarriage. But the other common ones are you have heart problems. The babies can have congenital heart disease. You can have hole in the heart. You can have tetralogy of the palate. All that because of diabetics. You can have some brain issues. You can have spinal cord issues as well. And so yes, uncontrolled diabetics do have birth defects, but they also have some issues to the mother as well. They can also cause kidney problems, eye problems, heart problems while you're pregnant. They can make sure your baby is big, and your baby is big, your shoulders will get stuck with normal delivery. It makes it difficult to deliver a normal sized baby, so you end up in cesarean section. Cesarean section will cause some wound infection and all that. So yes, it is good to screen for diabetic in every pregnant mother. I think Malaysia is doing it nowadays routinely for all pregnant mothers, whether you're diabetic or not. They're screening you routinely because it's such a common problem nowadays.
I see. Yeah. There's another question also. How can I lower my sugar during pregnancy?
It's from the same person again. Yeah. Wow. One person's very hectic. How can you lower your sugar? You can not take any sugar. That lowers the sugar. But obviously you can also, some people do, I at least recommend that you need to do some amount of exercise even though you're pregnant. And if there's no contraindication, no issues, no bleeding and all that, yes, you should do some exercise. Some walking, light walking around your taman and all that for about 20 minutes in the morning, 20 minutes in the afternoon. Now, because of the weather is being a bit hot, I suppose it's a bit difficult. But yes, when you do some amount of exercise, you burn the fat in your body, and that lowers the sugar. By reducing the sugar intake, you also reduce the sugar. And going on more on this cutting down on carbohydrates. Basically, no nasi lemak, no white rice, no white bread, no teh tarik. With all this, yes, you can reduce your sugars. And as Dr. Kiru was saying, have eggs and brown bread, and drink some barley and black coffee helps.
Yes. Okay, let's. I think we just say hi to all our viewers who are watching. We have Kai Chen, Grace Tan, Jolene Lim, Nadesh.
Our Dr. Nadesh.
Yes. How are you, Dr. Nadesh? So, coming back to fertility issues as well. If let's say a couple who comes has serious or medical issues, what would you do, Dr. Somas? Would you refer them, or would you manage them?
If they are trying to get pregnant, first I will normally always advise them to see the physician or the endocrinologist to settle their medical issues.
Yes.
Because if you are diabetic and you want to get pregnant, you are on medication to lower your sugar, but some medications are contraindicated in pregnancy. So we need to stop those medications, maybe convert them to insulin, change to metformin when the sugars are stable, and then only think about getting pregnant.
Right.
There are some antihypertensives also which causes some issues with the sperm production and sperm motility. So yes, so those patients, they need to see their physicians, tell the physicians that I'm planning to get pregnant, we need to change the medications first, and then then we try and get pregnant.
Okay.
If they're already pregnant and they have some medical issues, especially diabetics, I usually co-manage these patients with my physician, my endocrinologist, because they are more well versed in managing or looking for complications of diabetics in pregnancy.
Right.
Like they will look into the eye, to look into the kidneys and all that. So I manage the babies and the pregnancy. They manage the medical problems. It's a good combined.
Yeah, it's a good relationship. I think you have the experts available to actually address the patient in the center.
Yes.
Actually. Yeah. In another thing also, let's say for obesity, what is the weight reduction that you're anticipating to have a successful outcome for pregnancy? Do you aim for a number or
no,
percentage?
No, it's a bit difficult because I mean, if my patients are watching, they will know that because I've delivered a 140 kilo patient recently, no issues.
Okay.
So I mean, there are some pregnant mothers who are more than 100. Easily they've conceived 2-3 babies, so no issue. But basically, what we're trying to say is the BMI.
Yeah.
I think we should concentrate on BMI. The BMI should be about 24, 25. And also nowadays we're looking at the visceral fat.
Right.
So I think weight gives you a rough idea, but it's not the end all. It's not that just because you're 100 kilos. Of course, you're 100 kilos, you have lots of other complications.
Yes. Yeah.
But we look at the BMI and the visceral fat.
Okay. And coming to the point, okay. Yeah. So I'll be waiting for some more questions. Dr. Somas, if let's say now a patient is already worked up and everything, and you find that the patient is ready to go for the next step. So in terms of in vitro fertilization or artificial insemination, okay, maybe we can speak a bit on that. When would you advise and so on?
Oh, okay. We look at few things. One, if the main issue is with the men, if the spermatozoas, the sperm counts are very, very low, then we normally refer them for some sort of artificial reproductive techniques. If the woman has got some issues, we try and settle those issues first. If she is ovulating well, the uterus is okay, the tubes are okay, then yes, they can try naturally. So sorry, and I'm coughing. Oops. Do you think I need to be tested? Or I should be awake? Sorry. If the other thing we look at is if the mother's age. As we know, anyone more than 35, your success rate of fertility starts dropping. 35, 37, 40, it gets a bit more difficult. So if they're newly married and they're 40, 41, nowadays we know lots of women are getting married much later because they're busy with their occupation and social standings. So if they do get married late, then yes, we do not waste too much time on trying to help them conceive naturally. We sometimes fast track to some sort of reproductive techniques.
I see. And I think even now for patients who have breast cancer, especially as you said, so I think nowadays the age to develop breast cancers and so on also are becoming younger. And some of these patients will need tamoxifen or hormonal treatment as well, in addition to chemotherapy. And sometimes they need some form of fertility preservation as well. So I think that's when I refer them to Dr. Somas for him to actually get some egg preservation and so on. Maybe you'll say something.
I mean, fertility preservation is the new topic now. Everyone's talking about it. We in Gynaecologist, we are still working towards starting up a lab for fertility preservations, especially sperm preservations and egg preservations. So we will probably get back to that when the lab is all set up. But now currently we all are lockdown, shutdown. So we need to get things organized and.
Okay. Yeah, maybe there's another question here. Hi doctors, is that obesity causes hormonal changes?
Hi Hazel, how are you? Yes, obesity causes some hormonal changes. Basically, what happens is because of obesity, the hormones from the ovaries, the follicular stimulating hormones and the luteinizing hormones are not balanced, and because of that, the luteinizing hormones gets elevated because of your adipose tissue, and that causes hormonal issues. And because of these hormonal issues, your ovaries are not producing eggs. So when the ovaries do not produce eggs, they produce multiple small cysts, which are also called polycystic ovaries. And somehow along the way, it starts producing male hormones, androgens. So when you produce male hormones, I mean, every ovary has got a little bit of male hormones, and every man, as you know, has got a little bit of estrogen. So then these male hormones becomes enhanced, and the woman grows beard, they have hirsutism, hair starts dropping, and all that. So yes, obesity does have a role in hormonal changes.
Yeah. It is a kind of like a chicken and egg story, right?
Yeah.
Because is it the obesity that is driving the hormonal change, or is it the hormonal change that's driving the obesity? So
it's one complements the other.
Yeah. I think we have another question from Hani Min. Does pregnancy worsen diabetes? Oh, I think because you have gestational associated diabetes. Yeah, maybe.
Yes. Yeah. So because pregnancy is also known as a diabetogenic condition, where because of the placenta in the pregnancy, it produces lots of hormones, lot of glucose, lots of steroids.
Yes.
So pregnancy itself is a diabetic state. So if you're already diabetic and you get pregnant, your diabetic is going to be even more difficult to control. Yes. So it does worsen the condition. That is why if previously you were on medication, in pregnancy the medication will not be enough to control the sugars. So that's why most often we change you to insulin to manage the diabetic sugars.
Right. As we know, these mums who actually have gestational diabetes, they tend to have bigger babies and so on. Is there a possibility that the children will be diabetics as well?
Yes.
Predisposition?
Yeah. Because studies have shown that a diabetic mother, if the babies are obese, the big babies, the child is also prone to become diabetic later on. And also lead to childhood obesity.
I think that's the problem that we are facing now also, because if you look at the in schools and this one, we have a lot of children taking a lot of soft drinks. The sugar intake is up the roof actually. So yes. I think so the epidemiology of diabetes and in children as well, adolescents is actually increasing, and I think steps have been taken to try to curb the influence of sugars.
I think that also the canteen plays a big role. That is why the present government, or was it the previous government, where they were trying to give free food to the children, and the food that they were providing in the canteen was supposed to be quite adequate nutrition. With less sugars and junk food. So I think what they're doing is good, because I think we need to hit it at the butt at the school canteen. Otherwise, we'll be eating nasi lemak every day.
I think it goes across the board as well. I think even in our cafeterias, workplace, we should have a strategy where we can actually monitor the amount of calories that we are taking, and of course, whether it's good calories, bad calories, or what are the types of meal that is being prepared and all that. I think the initiative or the responsibility shouldn't only be in certain parts of society. Like currently, what we are facing now with the COVID outbreak as well. I think everybody should play a part, and we should work as a team. The only sad part is that when some emergency or some dreaded condition is when all of us actually get together.
Yeah.
But we should be doing this routinely, from day one for every disease that we are facing as well. Diabetes, be it hypertension and so on. I think we should approach it universally from an early stage as well.
We shouldn't wait for a pandemic to occur.
Exactly.
Before.
Yes, totally agree.
Yes.
I think we'll address another question from Hanim again. Can we eat brown sugar during pregnancy? I don't know why she wants to eat brown sugar during pregnancy, but I think, Hanim, you normally have it with your meal, right? With your drinks and so on, and maybe even with your bubble tea. Yeah.
They say brown sugar is not as bad as the white sugar.
Okay.
But if you are diabetic, of course, brown sugar also is a no-no. But if you are not diabetic and your pregnancy is going smoothly, a little bit, 1 teaspoon of brown sugar a day shouldn't
hurt you. That's why, Hanim, it's very important also, like the meal that we're having here today, as you can see, it all depends on the glycemic index. If your glycemic index is actually low, that means if you're taking rice, even like brown rice, actually the glycemic index is lower than compared to normal white rice. So this probably will be helpful during your pregnancy if you're having gestational diabetes.
Yeah.
So you can always consult a dietitian or even your doctors as well, and ask what is the appropriate thing they should have. I think most gynecologists probably will be able to help in that line as well.
No, sometimes we also refer to a dietitian to get it.
Yeah, true. I think when we have experts around, I think patients will benefit the most from a multidisciplinary team. Yeah.
I mean, this is where we do not say too many cooks spoil the soup.
Totally agree. Okay, Dr. Soma, it's been a pleasure having you. I think it's been a very engaging 45 minutes. I think it's been an honor to have you in the show.
Thank you very much.
Thank you very
much.
much.
I would love to give you a hug and shake your hands.
Likewise.
But because of the current situation, thank you for calling me.
Pleasure to have you, and hopefully we can have you again. I think, ladies and gentlemen, we'll be adjourning to our tea, and we hope you have a great day today. And as we approach this period of uncertainty with a restricted movement, perhaps, Dr. Somas, you have a parting word for our viewers?
Please stay home, stay safe, don't eat too much, and enjoy yourselves.
Yes. Until next week, see you again. Good night.